Buenas and half a day, everybody. My name is Kiana Joy Yabut from Famalao'an Rights. This is Famalao'an Talks, and we're back at the Guam Women's Business Center for the month of April. April is STD Awareness Month, and today we're going to talk all things STDs, STIs, sexual health, and I'm joined by a very, very special guest today, Dr. Mariana. If I could just have you introduce yourself, who are you, what do you do, all of that great stuff.
Yes. Thanks for having me today. It's been a while that I've been trying to get on one of these talks, so I finally was able to commit today.
So grateful.
My name is Dr. Mariana Cook-Huynh. I am a family medicine obstetrician. I work out of Sagwa MPG, and I've been practicing on Guam since residency for about 7 years now. I'm also on the board of Famalao'an Rights and very proud of that position.
Okay, well, jumping right in, again, like you said, we've been trying to get you on for forever now. I can't even remember when we first started trying to get you on, so we're really grateful to have you today. Let's jump right into it. So STDs, STIs, what are they?
Sure. So STDs and STIs are actually interchangeable terms or acronyms. STI stands for sexually transmitted infection. And that means it's an infection that your body has acquired or obtained through sexual contact, and it's caused by a certain organism, a virus or a bacteria. STDs are sexually transmitted diseases, so that's the disease state, the symptoms, the complications that can arise later down the road from sexually transmitted infections, but you can essentially use the two terms interchangeably.
Okay, so it's kind of like you get an STI and then it kind of transforms into an STD.
Yes.
Something like
Technically,
that.
yes.
Okay, gotcha. Yeah. And what are the most common ones that you see?
Yeah, so that's a really good question. So we are actually, since 2018, some data came out, Guam was ranked the 5th in the nation for chlamydia rates.
Oh, wow.
And that looks at per 100,000 people and our rates there. So we are very, very high in chlamydia rates on Guam.
In the nation?
In the nation,
wow. Yeah.
And then we often will see HPV, and HPV is just a common virus that's spread worldwide, actually. Mm-hmm. We see a lot of herpes. Mm-hmm. And then less common are gonorrhea, trichomonas, syphilis, HIV, hepatitis. And those are your big, very commonly heard of STDs that we will test for routinely.
And this is at what age group do you typically see these?
Yeah, so there are some high-risk groups that should really be aware of their increased risk of getting STDs. So that would include any individual who has sex under the age of 26, mm-hmm. men who have sex with men, mm-hmm. Pregnant women, not higher risk, but just we want to screen more routinely, so we'll offer screening when they're pregnant. And yeah, those are the big people, or the big groups of people. So if you're in that age group, even if you think you're having sex with someone who is safe, you've been with them forever, mm-hmm. you are at risk just because of that age. Yeah.
Oh, okay. So even if you've been with the same partner for 10 years, would you still recommend getting screened for STDs?
As a doctor, I would really just talk to my patient, the mm-hmm. woman or the man, and I would just ask them how they feel. And my patients will often hear me say that you only know what you're doing. Right, you don't know what your partner's doing. So we all know stories of partners mm-hmm. who are not faithful. Right. And so the sequelae or the complications that can happen, it's better to be safe than sorry. I use that term a lot with my patients too. Mm-hmm. So unless someone's really no, doc, I don't want to get tested, I really trust my partner, I'll just say, okay, I'm not going to push it. Okay. But if you're having multiple partners or you're having unprotected sex, even with your same partner, you really should consider getting tested.
Right. Yeah, I agree. Getting tested is one of the most important things you can do to practice safe, responsible sex. I think what I hear a lot from people when I talk to them about STD screening is they're just kind of scared to go into it. What is it? They're always is it a blood test? Is it are they going to stick something in my butt? All of that. So what are the most common forms of screening? How do you find out through tests if you have an STD?
So it really depends on the type of organism we're looking for and where it's commonly found in the body. Okay. So if you're going in for an exam, Some can be tested on urine. That's the least invasive. Chlamydia and gonorrhea are commonly tested in urine. But studies have actually showed that if you test urine versus a vaginal swab, you're going to get 10% less positive rates. So you're going to miss some people.
Okay.
Even if you do the test exactly the way the provider is asking you to do it. So the best way to test is to do a swab that goes inside the cervix. You talked about cervixes with Dr. Lee. For women, and then for men, a swab inside the penis. It's a tiny swab. Does it hurt? No. Is it a little bit maybe sensitive for men? Probably. But it's a very easy, simple procedure. So for women, you do need to do a not a pap smear. You need to do a speculum exam so that we can visualize the cervix, and then we have to put the little swab inside the cervix. So pretty simple. If you're getting a pap smear, we can actually collect the sample on the same.
I just got mine.
Swab.
I just got mine. Yeah, I got that.
I heard it with your audience. Yes.
It's like I don't know, like a 2-for-1 deal.
Yes. So if you know you're due for a pap smear, we'll often just offer it to you.
Yeah.
And then there are a few other trichomonas you can get from a vaginal sample, so that doesn't have to go in the cervix. And actually, if a woman is very hesitant to do a speculum exam, she can actually self-swab. So we give her the sample, we'll teach her how to do it. She can insert the swab in her vagina herself. And so all that fear of what's happening down there can go away. So you really just talk to your provider. Most of us really just want to do what you're comfortable with.
Right.
We'll tell you what we recommend, but if you have that open conversation with your doc, you can be able to get what you want.
So we're talking about STD screening, how the least invasive to the most invasive, I guess, and how to be comfortable with it and your doctor. I think another thing that I hear a lot about why people are skeptical to get tested is because, you know, like if you get tested and you hear like, oh, you have STDs, that's scary. And I think a lot of people would rather kind of live in that ignorance than to kind of face the truth. But I kind of wanted to ask you, because I'm also not really sure, like when you get diagnosed with an STD, chlamydia, gonorrhea, maybe some other ones, like what is the course of treatment for that?
So I'll answer that in a second, but I just want to backtrack from what you just said, that the reason our rates are so high for chlamydia is that often women and men don't have any symptoms. So you're not going to go to your doctor usually and say, I think I have an STD.
Yeah.
So it's really more about knowing your body, knowing how to stay healthy, and then also the greater good, right? Knowing whether you have something that you could pass on to other people. So I understand that fear of knowing that you have something, but I would say that chlamydia, gonorrhea are very, very treatable, and they're curable. So if you came and you got a positive test, then we would treat you, and possibly, if the provider was comfortable, treat your partner. And once you both take the antibiotic, it's pills you take, then you could actually cure the infection from your body. Now, there are things like herpes, HIV, hepatitis. Those stay in your body forever. They're not curable. You can get medication to help slow down your symptoms or decrease the severity of the infection, but those are infections that are going to stay in your body forever. And so that's really where it's important to know what you have for your own health, because women in particular, if they have some of these infections, it can cause pelvic inflammatory disease, which is a condition where you may have difficulty getting pregnant. And that's something that most women want to know about to protect themselves down the road. And then, of course, things like HIV, you can affect your immune system. You can get really sick from that. We're lucky on Guam to not have a lot of cases of that, but it could change in the future.
So I also think another thing that kind of makes STD screening and getting tested here is just kind of like the taboo and culture surrounding it. You know, Guam is still a little bit more on the conservative side. A lot of people are Catholic, so, you know, getting tested and having like a family member find out you got tested, it's like, oh, like she must be like sleeping around, things like that. And I just think that's so, I mean, even having a conversation like this is kind of like taboo. You know, how do we as an island community kind of overcome that? Because I think that's a big barrier to people getting tested as well, is they just don't want people thinking like, oh, like she has something, or he has something, or she's a slut, or like he's like, you know, having an affair, or things like that.
Sure. That's a tough one, right? It's always difficult to change cultural norms, and I would just encourage women and men to be open with their provider and know that they're in a safe place, and no one will know that you got tested. No one has to know that you have an STI unless you talk about it. And that, I will say though, if you're a young individual who's on like a family insurance, then your family may get the bill before you see it.
Yeah.
So you can go to public health and go to free clinic and get tested anonymously. And you can talk to your provider too about how do you get tested anonymously, and there are ways to do that. But really we need to normalize it, because we all know people are having sex, right?
That's what I say all the time.
We all know that Guam has really high rates, or maybe we don't, but now you know Guam has really high rates of chlamydia. And we know that it doesn't often give symptoms. So if you're having unprotected vaginal, anal, oral, or those are all of them, vaginal, anal, oral, sex, then you are at risk. And there are a lot of campaigns out there that talk about the 3 ways to prevent the spread is to talk, to test, and to treat. Yeah. So the first thing is talk about it, right?
Yeah.
And if you want to just talk about it with your partner, that's the first step. If you want to talk about it with your doctor, that's the first step. But be open about, I know my status, I want to know what your status is.
Yeah.
Because I want to keep myself safe and I want to keep you safe. And that is very fair when you're sharing yourself with someone intimately.
Yeah, no,
whether
absolutely,
you just met them or you've known them for 10 years. And then to test, right? Routine tests, we talked about that already. And then to treat. So once you find out that you know you have something, you should treat it and get your partner treated too. And if you have multiple partners, it should be your responsibility to let them know. And there are certain diseases that are called communicable diseases. So that means that I can share it with someone else. And so public health has to get notified of those. They're not going to call someone and say, so-and-so got this and gave it to you, but they are going to say that you've been in contact with someone and you should get tested or treated. And that's because there's a bigger picture out there than just you and your partner. So it's really difficult, I would say, to change those cultural norms, but your generation is the one to do it. I'm going to put it on you guys.
Yeah. No, I'm so serious. And I'm really happy to see that this kind of like Gen Z, like this new generation of like young adults is pretty open about it. You know, I know people who get tested regularly, if whether they're in a relationship or not, and it's always makes me so happy to see, because it's better to know. It's always better to know. Like there's nothing you can lose from having the knowledge of, am I being safe and responsible, right? Also, and this is just anecdotal, but in my experience, like if you are thinking about a relationship with somebody, or you're going to, you know, plan on having an intimate relationship with somebody, and you ask them if they got tested and they get offended, usually it's a pretty bad sign. In my experience, this is completely it's a red flag. It's a red flag, not mine. It's a red flag usually. Again, completely anecdotal. I am not a doctor like Dr. Mariana, but you know, just letting you guys know. Okay, so we've talked about talking. What was the second one? Testing and treating. And another thing that I want to talk about that doesn't start with a T is prevention.
Correct.
So what are some of your safe sex must-dos or safe sex tips?
You go and you read about prevention of STDs, everyone's going to start with abstinence, right? Just don't have sex. Realistically, not what I recommend people to do, right? I see
why.
I see lots of pregnant women, and their plan for preventing their next pregnancy is, I'm just not going to have sex. And eventually you are, because it's a very normal thing. It's how we entertain ourselves sometimes, right? So that is not my usual first go-to of how to prevent STDs. We have to be realistic that people are having sex. So how do we have sex safely? Condoms. Condoms are the number one way to prevent STDs. Okay. So that's number one. Number two is know your partners and talk openly about what they're doing.
So important.
Very important.
Very underrated.
Yep.
Underrated.
And then you yourself have choices about how many partners am I having at one time? Am I having sex with multiple partners without protection? And it's important for people to know that you don't even have to have full penetration. You don't have to go all the way. There are lots of young adults who are exploring their sexuality, who do a lot of like dry sex or just rubbing and touching, and you can transmit STDs by just skin-to-skin contact, depending on a person's viral load or infectivity at the time when you're in contact with them. So that's important to know too for those young ones who are just starting to explore their sexuality.
Yeah, so big one is wear a condom. There are so many kinds of condoms these days too. Yes. I've seen a lot of them, like dental dams for oral sex, and obviously the traditional one. Is there anything else you want to add?
Yeah, I did want to say that, and I know Dr. Dolores Lee talked about cervical cancer and probably HPV, but I want people to know that we actually do have a vaccine that prevents cervical cancer, and HPV is a STD that doesn't often get thought of in the grouping of STDs. People know about chlamydia, probably HIV, herpes, but HPV is actually a very, very, very common STD that increases not only women's risk of cervical cancer, but also men's risk of anal and penile cancers. And so there's a vaccine, one of a kind, that can actually boost people's immune system at a very young age, so that if they did get in contact with the HPV virus, their body can fight it off better. And
is that just the HPV vaccine?
That's the HPV vaccine.
Okay, gotcha.
But it's a cervical cancer prevention vaccine. Yeah. And so to have a vaccine out there that can help you fight off an STD, prevent you from having cancer, I mean,
again, 2 for 1.
Yes,
2 for 1 deal.
Just like your pastor. But that one too is like a cultural norm of, when do I give my kiddo this vaccine, and am I allowing them to start having sex because I'm open to having this vaccine? And those are just good conversations to have with your doctor or your kid's doctor.
Yeah, I mean, I think for the HPV vaccine, again, just knowing that it prevents cervical cancer is a really, really important thing. When we had Dr. Leon, she said it's like the most preventable form of cancer, and so it's really important to get vaccinated, do everything that you can to just stay healthy. So we've talked about safe sex, we've talked about STDs. Now, one of the most important things that I want to ask you is resources. Medical care in America is expensive, even here in Guam. What are some maybe free screenings people can get? Any clinics that offer it for free? All of that great stuff.
Yeah, so the cost is one thing, the anonymity is one thing too, right? So public health does have services for underinsured and uninsured individuals. Whether they make enough money or not, you can go and talk to them about that and get all the details. And then Todu Guam Foundation also does a lot of free services for the community. But any clinic you go into, if you want to get tested for STDs, you can just make an appointment just for that. Like, I want to get screened for STDs. Yeah. I want to know my status. I want to make sure I keep myself safe and my partner safe. And if you are going somewhere for like your routine annual physical exam, you can also talk to your provider then. And these are things that are covered by insurance. So if you do have insurance, it will be covered. And just be open to talking to your doctor about it. don't be embarrassed. You are not the only person on Guam to have
it's true.
high-risk behaviors or an STD.
I guarantee you are not the only person. Far from it.
So just, be open and just know that it's a private place where only you and your doctor are talking, or you and your nurse practitioner, or whoever it is. Yeah.
The HIPAA protection is so strong.
We take it very, very seriously. And it's hard on this island, right? Because we are a small community. But your providers should take that very, very seriously.
Yeah, no, absolutely. Okay, any final thoughts before we kind of wrap up this conversation on STDs, STIs, STD awareness?
No, I would just say, again, it's your body, it's your health, it's what you want it to be, your choice, absolutely. If someone's going to comment or judge or whatever, just know that you're doing it for yourself, and you have to prioritize and love yourself first above anything else.
So real, real. I love that. When we're talking about STD screening, we're often thinking about ourselves in relation to other people and in relation to somebody else, but it really is just about taking care of you and putting yourself first. I think that's one of the most important things you can do for yourself as a sexually active adult. Okay, great. So the question that I ask all my guests before they leave the show is, who is your favorite woman?
I think that one's going to be easy.
Mom.
Well, me first, of course. No, yes.
Oh, yes.
My favorite woman, yes, my mother. Like, being a mother myself now, I finally get it of like how much mothers give for their children. And I definitely did not appreciate that as much as I do now. And then my mother, of course, is just a wonderful, powerful, influential woman.
Absolutely. Okay, great. We love our moms. We love women. So yeah, that just about wraps up our episode for today. My name, again, is Kiana Joyabut from Famalao'an Rights. This was Famalao'an Talks, filmed right at the Guam Women's Business Center. This was Dr. Mariana, and we will see everybody next time. Bye.
Thank you. Bye.